Have you ever gone to the doctor feeling exhausted, foggy, bloated, or just not like yourself, only to be told that your labs are completely normal? You leave with no real answers, no explanation, and the same symptoms waiting for you at home. If that sounds familiar, this video is going to explain exactly why that happens and introduce you to a different way of thinking about health called functional medicine. Welcome to VitaRoot Health. This channel is dedicated to simplifying nutrition science and functional medicine research so you can actually understand what's happening inside your body and make informed decisions about your health. Our content is inspired by the work of leading experts in this field, including Dr. Mark Hyman, though this channel is independent and not affiliated with any specific doctor. Everything you hear here is for educational purposes only, not medical advice, so always talk to your own healthcare provider before making changes to your diet, supplements, or lifestyle. With that out of the way, let's get into today's topic. Conventional medicine, the kind most of us grew up with, is genuinely excellent at certain things. If you break a bone, have a heart attack, or get a serious infection, conventional medicine can save your life, and it does that every single day. But when it comes to chronic issues, the kind that build up slowly over months and years, like fatigue, digestive problems, brain fog, weight gain, or hormonal imbalances, the conventional approach often falls short. Why? Because it's largely built around identifying and treating symptoms rather than asking what's causing them in the first place. If you have a headache, you get a painkiller. If your blood pressure is high, you get medication to lower it. These tools are useful, but they're treating the surface, not the source. This is where functional medicine takes a completely different approach. Instead of asking, what symptom do we need to suppress? It asks, why is this happening in the first place? It treats your body as one connected system, rather than a collection of separate parts that each belong to a different specialist. Your gut health can affect your mood. Chronic inflammation can affect your joints, your skin, and your energy levels. Hormonal imbalances can affect your sleep, your weight, and your mental clarity. Nothing in the body operates in isolation, and functional medicine is built around recognizing those connections. So what does this actually look like in practice? Functional medicine tends to focus on a handful of key areas that often sit at the root of chronic symptoms. The first is gut health and the microbiome, the trillions of bacteria living in your digestive system that influence everything from digestion to immunity to mental health. The second is chronic inflammation, a low-grade, ongoing immune response that's now linked to nearly every major chronic disease, from heart disease to diabetes to autoimmune conditions. The third is hormonal balance, which affects energy, metabolism, mood, and sleep. The fourth is nutrient status, because deficiencies in things like vitamin D, magnesium, or B12 can quietly cause symptoms that get misdiagnosed as something else entirely. And the fifth is lifestyle factors like sleep quality and stress, which influence almost every system in the body. The goal of functional medicine is to look at these areas, figure out where the imbalance actually is, and address that imbalance directly rather than simply managing the symptom it produces. Let's make this concrete with an example. Imagine someone dealing with constant bloating and brain fog after meals. Under a conventional approach, they might be given an antacid or a general digestive medication. It might reduce the discomfort temporarily, but the underlying issue is still there, so the symptoms often return, sometimes in a slightly different form. A functional approach would instead ask deeper questions. Is there an imbalance in gut bacteria? Is there a specific food sensitivity triggering inflammation? Is stress affecting digestion through the gut-brain connection? By identifying the actual driver, the goal becomes resolving the issue at its source. So the person isn't just managing symptoms indefinitely, they're actually addressing what's causing them. This matters more than ever right now, because the diseases affecting the most people today, conditions like type 2 diabetes, heart disease, obesity, and autoimmune disorders, are largely driven by chronic inflammation and lifestyle factors rather than sudden, isolated events. That means many of these conditions are not only treatable but in many cases preventable or even reversible through consistent changes in nutrition, movement, sleep, and stress management. This isn't about chasing a perfect diet or an extreme routine. It's about understanding which changes actually move the needle for your health and why they work at a biological level. So you're not just following advice blindly. You're making informed choices based on how your body actually functions. This is exactly what this channel is going to focus on. We're going to take research-backed information from experts in nutrition science and functional medicine and break it down into simple, practical, and actionable content. No overwhelming jargon, no fear-based messaging, just clear explanations of what's happening in your body and what you can actually do about it. Some videos will focus on specific foods and how they affect inflammation. Others will dive into topics like gut health, hormonal balance, sleep, metabolism, and how all of these systems work together. The goal is always the same, to help you understand the why behind your health, not just hand you a list of rules to follow. If today's video gave you a clearer picture of what functional medicine actually means and why looking at root causes matters, that's exactly the foundation this channel is built on. In the next video, we're going to get specific and look at 5 foods that have been shown to fight chronic inflammation naturally, along with the science behind why they work and how you can start incorporating them into your routine right away. If this explanation made things click for you, take a second to subscribe so you don't miss the next one, and drop a comment letting me know what health topic you'd like broken down next. Whether it's gut health, hormones, sleep, or something else entirely, your questions are genuinely going to shape what we cover here. Thank you for watching, and I'll see you in the next video.